Thank you very much, Nestle and the organizers, for inviting me to present. It certainly is rather refreshing to be doing this face to face, so it's great. We're back on track. So, I am a speech and language therapist based in London, and I'll be talking to you about a new pediatric thickener that I had the pleasure of trialing for the UK and for Ireland. So just to declare my conflict of interest, the study was funded by Nestle Health Science. So pediatric dysphagia is actually a big thing. Between a quarter to almost half of parents would report at some stage that their children are experiencing some sort of feeding difficulty. Now, this is a range of feeding difficulties, not dysphagia per se. And we know that the incidence of the dysphagia increases in certain populations, certainly in the neurological population and children born premature. So looking at the US data, annually there's 500,000 children discharged with a diagnosis of dysphagia. Of course, it makes it easier for them to collate this data because they very much work in terms of the ICD codes, etc. In the UK, there's been data published by the Department of Health suggesting that there's been an increase in every 1,000 live births, a diagnosis of a feeding difficulty, or, an admission for a feeding difficulty, increasing from 2002 from 39 to in 2010, it was 57. So it's almost double. So obviously we're getting much, much better at managing the babies born premature and also saving the children that are very medically vulnerable with lots of other comorbid conditions. So alongside that, we also definitely have an increase in the diagnosis of dysphagia in the otherwise healthy or typically developing child, which would typically present either at an A&E department following a cyanotic episode, a serious choking episode, or later on, as we found in London in my Fulham Road, where I practice with my colleagues in the respiratory clinics with an incorrect diagnosis of asthma or compromised respiratory drives. So also, of course, we're getting much better in terms of our diagnostic tools and our awareness. So point is, we have more of these children. So what can we do for these children? And I'm not going to go into a great depth. So as in comparison to our adult colleagues, we're much more restricted in terms of how we can manage this. So it's about feeding techniques, positioning, the utensils we can use, RO, sensory motor exercises. There's no really evidence-based data for that. So today we're going to focus on consistency. So just to give you the background of the study, so we know that the use of thickener in dysphagia is evidence-based. We know that the use of thickener results in fewer hospital admissions, fewer respiratory symptoms, less polypharmacology, and also increased hydration and ultimately growth. If you look at, despite the impact that it has on the parent to use the thickener, parents are still satisfied in using this because their children do much better, they're healthier, etc. So in the UK, and I'll talk from a UK point of view, is that we have Nestle Resource Thicken Up Clear, which in my catchment area is what we use and very happy with it. But unfortunately, up till very recently, we could only prescribe it for children over the age of 3. So there's been a bit of an empirical movement in the acute trusts in London, in the UK, where we would use the resource for children from 2 years and older with the consent of the managing consultant and the MDT team. However, we found it very difficult to, of course, get our general practitioners to prescribe that because it's not licensed for under the age of 3. We have one other product available for children under the age of 1 or less than 3, which was not developed to manage dysphagia, And this is the company would be very open about this. It doesn't provide ITSI levels, again, because they don't put themselves out there as a dysphagia management product, and traces of lactose. So I work in a tertiary unit with a very big gastro and allergy caseload, so that would throw that out. So very frustrating. And although there is a movement in some countries, in some circles, to not use the thickener, we still very much want to, and so unfortunately it would end up with children ending up perhaps on a nasogastric tube for longer, etc., which is not very helpful or adding to quality of life. So voila, then Resource Thicken Up Junior arrived. And so we did the acceptability trial. So we looked at how it was accepted in terms of intake and how it was tolerated. We did it prospectively with all the necessary approvals and ethics committee approvals, etc. in the UK. So we ran the trial from August 21 to May this year. Unfortunately, there was a bit of COVID prior to that, slight hiccup, but we managed. So looking at our methodology, so we recruited patients attending NHS inpatient and outpatient clinics, and we used 3 sites. The children already had to have a diagnosis of dysphagia and had to be under the care of a multidisciplinary team. Very strict inclusion criteria, to which I'll come in a second. Informed consent, of course. And we asked the parents to first complete a 7-day diary in terms of intake of the amount of thickener, amount of liquid taken, also a 7-day tolerance diary. But then we asked the parents to continue for a total period of 28 days, because that's what we needed to get ACBS approval in Ireland. So gastrointestinal tolerance, as you can see, the standard, the list of tolerance markers, and then also intake, and we use the Bristol stool chart as a standard. So in terms of inclusion, of course, they had to be older than 6 months, because this is what the product is licensed for. Already on a thickener or needing a thickener. Now, just to put it out there that yes, for the management of gastroesophageal reflux disease or dysphagia, all my children I managed for dysphagia. So under my trial, they didn't just needed it for reflux management. We asked the parents not to introduce any new foods, as you can imagine, that might just throw a spanner in the wheel for the first 7 days. And of course, they had to give consent. So exclusion, if they couldn't or they didn't want to continue, any contraindications, list of ingredients. So every child that we approached, or family we approached, we also approached the dietitian and the consultant to check that they would be suitable in terms of an ingredient point of view. Any allergy to milk, and just because this product is made in a factory that handles milk. Younger than 6 months emergencies, and they couldn't participate in any other study at the time. What I found really helpful was the information that comes along with this product, because information is such a key thing. And I'm sure you'll agree to explain the diagnosis of dysphagia, which can be absolutely devastating, very confusing to a parent. Then you pull out a tin of something and tell them how to mix it up, and you send them away and hope everything goes fine until you review them in clinic, or acute management is slightly different, but I'm talking from an outpatient point of view. It comes with very, very clear instructions on how to prepare this in terms of volume, how to prepare it in a bottle versus in a cup, how to prepare formula, water, whether you're using soft water or hard water. And that was something really interesting that I never really thought about, because in London our water is extremely hard. And so that's probably why we've been struggling with getting consistency. And then, of course, orange juice and herbal tea. So this has been very helpful. It comes in a very nice downloadable format, and it's got a great link that you can provide to parents. Also, to provide to nursery schools. Nursery schools have time and time again expressed to us how they find it very, very difficult to manage these children in nursery school out of a fear that the child is going to have an aspiration episode on their watch. So again, the more information you provide, the more reassured they feel, and probably will affect the child's enrollment in that preschool setting. So looking at our recruits, we approached 36 potential participants, and some didn't respond, some declined, some stopped the trials, and some pulled out later because of symptoms, not because of a reaction to the thickener, but because they became unwell, one with COVID, for example, as expected. I found it really interesting that how some parents would complain about the other thickener, would not enroll in the trial, and yeah, it's been interesting. I suppose there's been a bit of a hangover of wanting to come into a hospital following the pandemic, etc. So as you can see, there's been quite a wide age range. The older children, the 9, 8 years were recruited from my hospital up the road, the respiratory hospital, hence the older age. And of course, a range of pathology and comorbidities. But what is really interesting or important to take from this data is that 10 out of the 15 participants were under the age of 36 months, which is exactly what we needed to prove that this was going to be a thickener that was going to work. So looking at the ITSI levels, it ranged from 1 to 3. Again, ITSI 3 more used in the older children, and the younger ones 1 to 2. Thank goodness no adverse events, always good for a clinical trial. So 3 refused the thickener and then had to withdraw from the study. All our hydration targets were met, and the majority did not report GI symptoms. I'll come to that in a second. And 3 became unwell, unfortunately, and it had nothing to do with the thickener. The parents were all throughout very, very happy with the thickener. So looking at the GI symptoms or tolerance reported, most of the symptoms that were reported were completely transient in nature. So for example, the vomiting was on the first day and never happened again and could have been the result of something else. One could argue that these would be sort of transient GI symptoms that you would see in perhaps a standard toddler or infant. So very, very well tolerated. So for me, the most important was the patient experience. There's been a very interesting study published this year by, I hope I pronounce this correctly, Simeone, 2022, where they used the Paediatric Quality of Life Inventory and applied it to parents of children with dysphagia. And they compared it to studies of parents who had children with acute liver failure and who had kidney transplants. And the parents with dysphagia reported much higher scores. So the impact of dysphagia on a parent and a family should never be underestimated. It's very disempowering if you can't feed your child, or if you have to be socially excluded, be different, struggle with feeds, etc. And I'm happy to report that we've had very, very, very good feedback from this. So it was empowering, it was including, and altogether it made everybody feel less stressed. And as you can see from the quote, where the little, how do I go back? Where she would go, this little girl would go up to the drinking station and get her bottle of thickened drinks and just do it herself, as opposed to somebody walking behind her and almost nagging her to drink all the time. And then, of course, to what we alluded to earlier, is that the nursery staff were much happier to use it as a product. This is really important because long gone are the days where we can dictate to parents and patients what's working for them and what not. It's a complete patient and public, etc. involvement, I'm sure you're aware, is really, really pertinent in the success of any intervention. and also the impact on our healthcare. So I'm happy mommy, happy daddy, happy therapist, happy child, everybody's happy. So that's really good. But it's a safer practice because, as been earlier alluded to, is that the ITSI levels can stay consistent. So you can send a patient away knowing what you advise is how it's going to end up being. Better compliance. I mean, how many times do you actually, when you review a patient, they'd say, had a little bit of brother's, orange juice. And I even have little kiddies that have been so desperate, they go and drink out of a toilet bowl just to get the thin water. Something else that I found, and this is just my own anecdotal experience, is that when I do video fluoroscopy and I mix this thickener with my contrast medium, including barium sulfate and water-soluble contrast like Omnipack, it thickens as it should do, which hasn't always been the case with some of the other thickeners. So I can happily translate my video fluoroscopy findings into recommendations. And of course, for my managers, it's very, very good because it's cost effective. They don't need so many appointments, and they might not need intervention like enteral feeding or management of the other gastrointestinal symptoms. And so just to acknowledge, I just want to thank all the families that were willing to put their trust in us and trial this product. I want to introduce you to Franklin that started with us. It's very small and had to put him completely nil orally. And as you can see on the right-hand side, Franklin is eating and drinking very well. Thank you.